Hey everyone, it's Nancy, registered dental hygienist and Burst TV member. I wanted to bring to you guys a segment on tongue scrapers. So we clinically talk to our patients about cleaning their tongue, removing the bacteria, how to prevent bad breath, but how often do we actually tell our patients exactly what kind to look for, where they can find it, the cost, and the reality of how easy it is to find tongue scrapers. So I jumped into the shoes of my patients and walked down the dental aisle myself to see what was available. So my first stop, because I'm a lazy shopper, I went to Amazon. Amazon had a wide selection and different variety to choose from, but it was a little overwhelming. And my first reaction was, wow, they're really not that affordable. I have been guilty of telling my patients before, use the back of a metal spoon and scoop the tongue to help remove all of that debris, and you'd be surprised of what comes off. I've been spoiled and I've been using my own favorite ones that worked well for me over the years. There's not enough research to tell patients that it will help prevent and treat long-term halitosis and bad breath issues, because there's way too many factors that contribute to bad breath and halitosis. But what we do clinically know is that tongue scrapers work as far as the physical removal of the gunk and the debris and the plaque and the bacteria off of your tongue surfaces. When our patients have chronic bad breath and halitosis, it could be contributing to different things: medication, dry mouth, acid reflux, tonsillitis, tonsil stones. These are things that we want to dive deeper in when our patients complain about having bad breath, to be able to troubleshoot and help them alleviate some of these symptoms. All right, so our first tongue scraper that we're going to try is the Orabrush. I picked this up at Target, and unfortunately this was the only tongue scraper that was available over the counter at Target, and it was $5, $4.95 or $4.98. So I'm just gonna stick my tongue out and scrape it for you guys. Instruction says you're supposed to just pass it from the back of your tongue forward several pats and do it 2 times a day. So here we go. And it just really scrapes on the top surfaces of my tongue, mainly on the saliva that might be left on the tongue. The viscosity of what it's removing is more of a liquid layer. So I've seen tongue scrapers remove more of a thick, viscous bacterial gunk on our tongue. So Orabrush, if my patients like it, by all means, but I feel like it could do a lot more. Second brush we have is Dr. Fresh. It's a triangular and it has 2 blades. The blade that's supposed to fit your tongue, it's a little bit sharper. It has a more rough edge. So you can see, oh, that's gross. I'm sorry, but it does do a pretty good job. I'm guessing if you use the razor blade on your tongue, the same texture of the razor blade passing on your skin when you are shaving. That's what I feel when doing it. I don't really like that texture. It almost makes me feel like there's nails on a chalkboard kind of thing, but it does effectively remove. So far, the Dr. Fresh style tongue blade I feel works better than the Orabrush, but let's continue. We have the Dentec brand. I feel like Dentec brand or these styles will be more easier to find. The Dr. Fresh, I found this at the dollar store, and it came with a whole pack with a toothbrush, a little pick, this, and a mirror too. So that's kind of cool for the price of $1. I find it's very cost effective for patients to have. So this might be a better win-win. The Dentec brand, I found this one over the counter at Walgreens. Most drugstores should have Dentec brand. Same thing. These edges are going to be a lot softer. It doesn't have that sharp, rigid edge like the Dr. Fresh one does. It is coated in silicone on the outside, and then this plastic one is hard here. So I mean, you know, it removes, works good. I guess it really comes down to patient preference, right? in addition to what you know works best. So the last two. These two are going to be my favorite. I know that there are copper metal tongue scrapers that are supposed to work the same way too. Breath RX, my favorite brand, but this probably will be harder for patients to find in over the counter because these are normally ordered by dental professionals unless your dental office has it. The Scrape Your Tongue, I like it. I personally bought a box of 100 for $25 and I give it to my patients. So that's a purchase that the office does not buy. I bought it myself for my patients because I know it works and I want them to have something great at home. So I'm going to try these two just to demonstrate. Look how much that removes. See, this is the thick stuff that I was telling you about. The other tongue scrapers, it just scrapes off that first thin saliva layer, but this is where the bacteria is at. This is the gunk on those ridges of our taste buds and in between the ridges of our tongue. And last but not least, let me demonstrate the Scrape Your Tongue one. There's only one side with the teeth here, and the great thing about Scrape Your Tongue is they actually will donate one tongue scraper for every one that's sold to schools. It is a subscription that allows patients to buy these at $1, and there's a $3 shipping charge, but I believe Amazon will sell these for $4.99 with free 2-day shipping. This is going to be a little bit similar to the Breath RX one, a little bit shorter, but same concept. I really like the subscription part of it because it actually keeps patients compliant. You guys, how easy was that? It's not even messy. My tongue is pink again. I've been waiting 2 days of not scraping my tongue to do this segment for you guys and show y'all my favorite tongue scrapers. So, when patients ask you what tongue scrapers you recommend, hopefully this Burst TV segment will kind of give you guys better insight so that y'all don't have to go on a tongue scraper journey of looking for or buying all the different types. Hopefully Burst will be coming out with their own, maybe, I don't know, I'm hoping so. Do let your patients know though, having a tongue scraper is proven to be 30% more effective than brushing your tongue with just your toothbrush alone. Comment down in the thread if you guys have your favorite one that I have not tried. I'm all for trying different ones. Have a great day, enjoy. Thank you for watching Burst TV.